It's October 18th, 2022. I'm in this pattern. I spoke to Dr. Trotta. She called me back from St. Francis yesterday. She had some medical conference she was going to, so she could not see me this week. She's the hematologist oncologist. So that means she deals with blood disorders and cancer. I informed her because she called me back directly. I thought her assistant, I was waiting for her assistant to call, but she called me direct. Um, I told her I was having trouble with like high order mathematical function, um, almost like a brain fog. I call it spacey, like whatever. Um, Sometimes it's harder than others. Um, but I told her I needed to come in. She'd mentioned in October for a follow up for blood count. Then she said the last time I was in, my blood was fine, but that was in September. And I'm like, right, but you said you wanted a follow up appointment to check to see if my count and my numbers were still okay. And again, to look to see if I was holding the iron. And she's like, right, well, I won't be there, so you can come in and whatever. And she says, but I really want you to see your regular primary, like your regular doctor. And I'm like, beanstalk. I'm like, all right, so what do I do? Like, just book an appointment with her. I can get the blood work done there. She's like, yeah, I definitely want you to do that. She's like, you're coming to my office for blood work. I'm like, right, again, like, I mean, thinking logistically, just if her recommendation is I have to go see this other doctor, then there's no point. But here's my, like, I just said to Lynn, because now I'm having another issue along with the cloudy fogginess. I've got this taste. It's like after someone smokes a menthol cigarette, it leaves this residue on the tongue. Some kind of inhalant that they put specifically menthol brand cigarettes, and it leaves that flavor on the tongue, and it's but without the burnt charred smoke of a cigarette, but just walking around outside, that's just in the air lingering, like this oily, almost like a petrol, like jewel oil type residue. So, and without lighting a cigarette, without taking a puff on a jewel, it's just lingering in the air. It leaves this taste just from breathing in the outside air, along with this fogginess of whatever that's going on. So I have now some kind of, it looks like blood in the urine again, and it looks like epithelial tissue in the UA again. So I said to Lynn, I'm like, she's like, well, call a urologist. And I was thinking to myself, I'm like, this is so, I was like, I've been to the hospital. I expect if I go to the hospital, they have the capabilities of doing the diagnostics there and doing a thorough checkup on if I made the effort to go into an emergency room. Why are they not like the TV shows, like the made for TV people, where like you go in and they just keep going through their specialist list and diagnostic tools that they're equipped with? Because for me to sit at home and make an appointment with a specialist, first the primary, then the specialist, then I go with the specialist, then I have to go for diagnostic tests, then from diagnostic tests I have to go back to the specialist by the time they have time to read it, to then figure out what it was, and still nothing's fixed. I mean, like, how much time is wasted on the calendar? I mean, it's like, this is the most ridiculous process. It's ineffective, and it's pushing people into more danger. If cancer is like every second you got, the faster you find it, the quicker you have, the better chance you have of survival, of fixing it and living through it. Then why are they sending me for months and years worth of like just shrug offs? Try to shrug me off, but she's kind of interested, but kind of not. Then I gotta go to Beanstalk. What the hell for? So she's gonna take blood, but like I was trying to talk to her about the whole septic thing and like the density of the urine thing, and she was just like, I don't even know what you're talking about. And I'm like, you're a doctor, that's really frightening. But like again, right, got it. Okay, I need to go to a specialist because the primary doctor's not equipped to handle that level of conversation. So like, I mean, so where do you, so at what point do you go to the hospital and they actually do what they're trained in medical school supposedly to do? I mean, when do they use those hospital resources and the insurance that you have to marry those together and fix a patient, since they all swore and took an oath, but now they're not even performing at a level that even cognitively makes sense? I'm just curious, humans. So now I'm saying to Lynn, and then the conversation comes up. I'm like, well, should I try the Queen's Hospital? She's like, no. I was like, why? She's like, just no. And I'm like, yeah, but the last time I went to Nassau, it wasn't really like Nassau anymore. It was like Queens. And she was like, no. She's like, if you think Nassau's bad, she's like, Queens is like United Nations. She's like, you don't want to go there. And I'm like, right. No, I know I don't want to go there. I was like, that was my first thing. She's like, go to Nassau. And she's like, because even if it's getting like Queens, she's like, it's better than going to Queens. And I'm like, right. Good point. And she said there's a third option. Well, because St. Francis is in Port Washington, I thought that was an option, but they were even more useless as far as an emergency room goes. And diagnostic tools, they're like a heart only specialty. And what is it, DO? What's a FACS? What's an MD? What the hell's the difference? Like, I mean, the public has no clue what you guys like are pretending to accomplish here. I mean, like, and I mean, it's really confusing to all of us how this is supposed to work with you all practicing on us, but never getting to that performance where you really like knock it out of the park like a superstar sportsman. I mean, it is just like. So I'm like, ay, ay, ay. So do I go back to that horrific North Shore that's no longer Long Island Jewish? And no longer looks like any Long Island that I could ever remember. And then I mean like I'm logistically like if I have to explain every doctor's attempt I made, it is so easy. I mean, their process is broken. The go from a primary to then make a specialist, in some time dilation where your health is just deteriorating. There's stuff going on in the local atmosphere. My body is rejecting at some level. There's some more serious, whether it's infectious disease. I don't know. I mean, like, at what point does that even come into play in the hospital when you go to the emergency room? I mean, when do they screen for that? It's so frustrating. It's disgusting. It is medical neglect and abuse. The medical staff upon my person. And it's just so evident on top of the other like battery from the state level against my person, chemical battery. Yeah. That's also on my hidden record, like hidden from myself. I don't know who handles that stuff, but it doesn't seem like it seems to be a priority of anybody who actually like cares about me living. So I'm torn because, like, do I want to go spend the next 5 to 6 hours sitting in an emergency room? No. But the last time I went there, they didn't really like give me any answers either. And they didn't really perform any diagnostics. I really didn't find any high intelligent doctors there. I mean, I got a medical student and then part of the transport team in hospitality. I mean, it is just frightening. Unknown source of bleeding, but at a low level, not like hematologically, whatever. But the epithelial slough is of high concern. Like, I don't know the signs of cancer. I don't know the signs of bladder cancer. I don't know the UA having this very like industrial ammonia cleaner smell and some kind of pelvic floor whatever trying to escape the body somehow. I mean, it is just like, and then going to the hospital and explaining it to the medical staff, and the medical staff's like unprepared to even handle that level of acknowledgement of what's wrong in the crisis situation. I mean, it is just like, it's really frustrating. Physical therapist said, though, today I have a spasm in my lower left dorsal area. Um, he was very good at trying to find what was wrong in what area and then gave me exercises because I have weakness in that area in order to try to strengthen in between the physical therapy sessions, which was nice. But it is just so amazing how I'm having this weakness on top of, like, this scary weakness where it looks like my muscles are deteriorating. Um, and it's making movement much more difficult, which means that I'm losing muscle mass on top of this menthol, petrol, oily taste on my tongue that I can't escape from, and this high amount of like industrial smelling ammonia, and then this epithelial slough and bleed out of nowhere. I mean, these are all signs, and then like this fogginess on top of it. It's not like the drive isn't there, although it's reduced capacity. It's just the amount of steps I need to take in this reduction of capacity. And they're not even logical steps. I'm like sitting here, I'm like, who created the system? Like, in their good conscience, bullet in the chamber, asking a question, who designed this and is causing this to occur this way? I don't even know if they're like able to answer that. Because this makes no sense whatsoever unless your mission in life is to make sure that I die as painfully as possible, as long and drawn out as possible, and for nobody to find out how you all took part in it willingly and went against your oath you took when you took the education and you joined some health group in the state of New York, which has charges against itself it's trying not to like come to terms with my person while it's here. I mean, it is just unbelievable the amount of abuse and neglect. And even with my attempts on a personal basis as like vice princess, just trying to interact on a one-on-one basis, you're a good human, I'm a good human, blind trust and brain trust just between the two of us. I need to get in a healthy way. and I need to get my health back because I got stuff to do at like Last Supper level and like whatever else is going on that then is some kind of like umbrella. And I can't even get that level. So it makes me have like antitrust issues with the level of humanity that's operating in my field that won't operate in a manner with me, and not operation like surgery, because I don't want unnecessary surgery, but I do want to catch the health problems before it requires surgery. And I can't even get that level. There's no nutritionist, even though I'm seeking them out. I found physical therapy, but there's other environmental and atmospheric problems going on. And then I've got the participating doctors between the primary and then all of the useless specialists. I mean, the amount of time wasted is so disgusting. And it's like around and around in a loop. And I know I'm repeating myself, but it is that disgusting. That's just how illogic their system is that they're functioning within in some discourse. And I don't know where the recourse is from my perspective. It's star 1978, star 8378, Nicole, Cattaruzza. It's Earth, solar system, Milky Way universe, galaxy is broken, and it's Bayside Station, Bayside, New York, 11361.